Everyone, welcome back to my YouTube channel. In this video we will talk about the medication as well as surgery. There is no definitive medication that has been shown to effectively treat the lymphedema, as diuretics are typically prescribed to treat the patient with the high flow edema such as congestive heart failure. Lymphedema patients often are prescribed diuretics too. However, many experts believe that treating lymphedema with the diuretics is ineffective, as at a best it can actually lead to the fluid and electrolyte imbalance as well as further concentration to the high protein edema that may worsen the symptom of the lymphedema. Benzoprine such as the coumarin or flavonoids stimulate the macrophage activity that is inhibited by the presence of the lymphedema, which can degrade the level of the protein found in the lymphedema. These drugs have been prescribed in the Australia and the Europe. The US Food and Drug Administration (FDA), however, is not approved them in Australia. Oral coumarin has decertified as a result of increased liver toxicity that result in the several deaths. Although topical coumarin is still available, the use of the natural occurring benzoprines as biflavonoids, horse cancer, and the grapeseed extract is also controversial, should be done with the caution. Now we will talk about surgery. Because the largest lymphatic vessel that valves to prevent the backflow and these vessels themselves serve as a pump by contracting at regular interval under the control of the autonomic nervous system. Surgical efforts to simply replace the lymphatic vessel with a synthetic tube have in the past been largely unsuccessful. Never microsurgical and mapping procedure performed by the skilled surgeon well versed in the lymphology, such as the analogs, lymph vessel transplantation, lymphatic venous anastomosis between the lymphatic during the axillary dissection, and axillary reverse pumping during the lymph node biopsy to hold promise. Removal of the excess skin and subcutaneous tissue is another surgical method that is sometimes used to treat lymphedema, although it does result in the removal of the superficial skin lymphatic collateral. Once a lymphedema patient has been superficially treated with the conservative method, surgical removal of the remaining excess skin folds can sometimes be helpful. Liposuction removal of the suprafacial fatty acid is another surgical procedure performed in the some lymphedema patient. Traditionally, liposuction is likely to further damage the lymphatic vessel that can precipitate the formation of the lymphedema or accelerate the progression of existing lymphedema. In contrast, a never form of liposuction called transient liposuction is increasingly used worldwide and is likely to cause a damage to the lymphatic system. With the procedure, the surgeon injects a vasoconstrictor, epinephrine, and local analgesic lidocaine that make the fatty areas swollen and firm to transient, which prepare the fatty areas to be surgically removed by the small micro cannulas. Then here is a table about the imaging of the lymphatic system. Imaging of the lymphatic system, and first of all, direct lymphography. Second is indirect lymphography. Then third one is lymphoscintigraphy, LAS, lymphoscintigraphy, LAS. Then MRI, magnetic resonance imaging, computed tomography, which is known as CT scan, ultrasonography, and then fluorescent myography, microlymphonography. अगर इस सारे में आपको कोई भी इशू हुआ हो तो ज़रूर कमेंट सेक्शन में पूछ लीजिएगा. अल्लाह हाफिज़.